Hello everyone, Chris Houston here. Today's session, we're going to talk a little bit about the dry powder inhaler, or DPI. The correct DPI is dependent on what type of DPI is to be used, because there's many different manufacturers and medications that can be given via DPI. Disc inhalers, Discus, and turbo inhalers are just a few. Each type requires a slightly different technique. So remember, the package inserts are a great resource to determine how the DPI is to be utilized. Remember, DPIs create an aerosol by drawing air through a small dose of dry powder. Unlike MDIs, DPIs do not use a propellant. DPIs require less patient coordination than an MDI. However, some DPIs do require a greater inspiratory flow for adequate aerosolization. Remember, after the patient takes the inhalation, it should be followed by a 10-second breath hold. So let's look at the Discus that I have here today. This is an Advair Discus, and these are pretty compact, as you can see. The patient can just open the Discus up, and there is a counter to indicate how many doses remain, as you can see right there. Basically, the patient just activates or loads a dose into the Discus by pushing down on that there, and the Discus is ready for the patient to utilize. Basically, what I would suggest is have the patient expire all the way down, then put the Discus in their mouth, take a large breath in, and hold it for 10 seconds. If the patient has adequate inspiratory flow, that should be sufficient to administer the dose that's in the chamber. Again, very, very easy to use, very compact device, can be placed in a purse, a bag, and taken anywhere. So they're very, very convenient in that way. Now let's relate the DPI to our performance evaluations that we have in our clinical laboratory book. As we know, we have performance evaluations for all the different procedures that we'll be looking at in the lab. So with the DPI, first off, we're going to verify the order. We're going to give a DPI treatment to a patient. We're going to verify the physician's order. We're going to observe universal precautions, including hand washing, before we enter the room. Obtain the necessary equipment that you're going to need for the therapy. Remember, you need to identify the patient and introduce yourself to the patient as well. Nowadays, what we're doing is we're utilizing 2 identifications for the patients to ensure that you have the correct patient. Name and date of birth is traditional, and many organizations use barcoding as well to further increase safety. So monitoring the patient, we're going to do a set of pre-vital signs before therapy. Monitor the patient, we're going to look at heart rate, respiratory rate, breath sounds, and peak expiratory flow with a peak flow meter. Then we can go ahead and administer the dose through the DPI to the patient. Monitor once again the heart rate, respiratory rate, breath sounds, and peak expiratory flow. Once the dose has been administered and the post-vital signs have been recorded, we need to assess that the patient tolerated this well. Was there any adverse side effects during the therapy? Once that's complete, clean up your area, clean up the packaging, put everything away for the patient, and then of course we're going to record the results of our treatment into the medical records so that the rest of the care team can evaluate how the patient's performing with the medications that have been ordered. Just a review on peak flows. This is a AirAlive peak flow meter, very simple to use. I'll demonstrate its use just to reinforce how peak flow meters are used. Remember, have the patient breathe all the way down. Big breath in. Now remember, with peak flow, it's all about speed. Expiratory flow, very fast, very quick. It's not a slow vital capacity. It is a very quick maneuver. So in this case, I hit about the top, about 800, and you'd want to repeat that at least one more time to ensure that you have reproducibility. Record that number as your pre-vital signs before the DPI is administered, and again, repeat the peak flow after the treatment has been completed to see if there was any improvement. You might want to allow a little bit of time for the medication to work, but generally it's a great idea to do a pre and post peak flow meter with your DPI treatments. So again, many different types of dry powder inhalers. We'll be talking a little bit, and your book has some details on the different types. Again, disc inhalers, turbo inhalers, etc., etc. So I do recommend that you take a look and make yourself familiar with the different types of dry powder inhalers. Hope that was helpful, everybody. We'll see you next time.